Good afternoon, ladies and gentlemen. I am Katyayni, your host for today. I welcome all of you to yet another episode of our ongoing series of discussions on arthritis in India to mark Bone and Joint Health Awareness Month. We thank Pfizer India for helping us put this series together, and I would like to welcome our distinguished panelists for today. We have with us Dr. Rohit Pandey, who is the Sports Injury and Anthroplasty Specialist at Chakra Bone and Joint Center in Galaxy Hospital, Varanasi. Welcome, Dr. Rohit. Thank you so much for joining us today.
Thank you so much for having me today.
Yeah. We have with us Dr. Anuj Gupta, Consultant Orthopaedics, Preeti Hospital, Allahabad. Welcome, Dr. Gupta. Thank you so much for joining us today on this session.
Thank you, Katyayni. Thank you, all the audience.
And we have Dr. Ajit Singh, Orthopedic Surgeon, Joints and Sports Injury Center, Varanasi. Welcome, Dr. Ajit. Thank you so much.
Thank you so much, viewers, for giving me this platform. And yeah, I hope a positive this one. Yeah.
Right. So I'll start asking the questions. My first question is to Dr. Ajit Singh. So, can you provide us an overview of, what is arthritis and what are the different types of arthritis and what is their prevalence in India?
See, arthritis is a very broad terminology. If we speak on the medical ground, so majority of patients, what they think all arthritis are same, like degenerative arthritis, rheumatoid arthritis, any kind of arthritis. You must have heard that गठिया हो गया है. So what गठिया is, it's as a very broader terminology. So prevalence of osteoarthritis or rheumatoid arthritis is very high in India. So osteoarthritis is two types. Basically, if we want to divide into two categories, one is an inflammatory arthritis where the immune response of our body work against the joint, and the other one is a degenerative arthritis or osteoarthritis. So it comes with a aging. It's come in an aging population, and if we are not very careful about our bone health or our lifestyle, this disease tend to involve early in our age group.
Right. Thank you so much, Dr. Ajit. Dr. Anuj, my next question to you. So, if you could tell us about the common symptoms that patients see in arthritis, and what are some key risk factors that are associated with this condition?
So primarily, the patient reports with pains and aches, which may dwindle with the advent of time. It may be waxing waning kind of a pain for osteoarthritis essentially, but for rheumatoid arthritis, it will be a constant dull aching pain. So there'll be morning stiffness along with it. There'll be morning stiffness along with it, and also that the joint might become a little tender and swollen to touch, and it'll be difficult walking. There'll be a limp around for the patient. And see, arthritis can be about 144 types of arthritis in the body. So we have to first delineate which kind of an arthritis are we treating or are we dealing with. So essentially, for osteoarthritis, which is an age-related arthritis, arthritis, as Dr. Ajeet said, is a misnomer. It's for the inflammation of any joint of the body is known as arthritis. So that will create pain, tenderness, swelling, and also there may be loss of function in that part of the body.
Right.
And the essential risk factors, the second part of your question is that maybe a trivial trauma or some excessive exercise at some time might give rise to some kind of an inflammation in that part of the body. Like if you're doing some stretching exercises or you're doing gym, you might
Right.
create your you might hurt your knee, or you might create some sort of an inflammation over there. So essential risk factors are not only age, that advancing age which results into arthritis. There are other factors. If for that matter you are consuming a lot of non-vegetarian food, you can have a gouty arthritis also. So the risk factors are many, and these are presentably the basic ones, wherein age and some comorbidities like hypertension or diabetes and uh, even thyroid, even obesity also gives a lot of
Right.
strain to the joints.
Right. Thank you so much, Dr. Anuj. Also, if somebody has a family history of arthritis, could that be also a presumable risk factor?
Yeah, correct, correct. Absolutely, absolutely.
So somebody who has that in their family history can also be more prone, if I may ask.
They are more susceptible to, definitely they are more susceptible to getting an
Okay.
age-related arthritis. Yeah, correct.
Okay. Thank you so much for answering that, Dr. Anuj. My next question is to Dr. Rohit. Sir, how does early diagnosis impact the overall treatment outcomes for individuals with arthritis?
So, as we all know, that already described very nicely by previous speakers, that the prevalence of osteoarthritis is quite too much nowadays. It is around about 40% in the Indian population. So, if we early means the early we identify the arthritis, the more we can give the joints time to be remaining more healthy for a longer duration. So, what is exactly is required that, especially in case of osteoarthritis, once the age is on the higher side, then you have to do few lifestyle modifications like the floor level activities you should avoid. You should start doing a little bit of cycling, and the climbing of stairs and all you should avoid. So these things, if you diagnose early, so what will happen is that the means you have to understand it's basically a process between wear and tear. So the amount of force acting on the joint, if you reduce that early in your life only, so it will give a longer life to your joint. And especially in the earlier age groups, when you are in your 20s or in your 30s, the exercises, the nutrition is going to help you a lot. So early diagnosis in these cases, if it's an inflammatory arthritis, then definitely you have to start the patient on few medications so that the arthritis stage doesn't go into a very end stage arthritis. So these are the things that in the early stage, especially if you diagnose inflammatory arthritis, the joints you can means you can prevent the joint more. And in case of osteoarthritis, once you start the initial stage of arthritis, like a stage one or stage two, at that time you can start doing few lifestyle modification and activities which will give a longer life to your joint.
Right. So, following up on that, on what you mentioned, can you share some effective strategies for managing arthritis, both medical and lifestyle approaches, like you mentioned? So, what can some strategies be in order to manage arthritis? Patients who are, struggling with arthritis, how can they manage their day-to-day lives?
So as is already told that you have a either a conservative treatment, or you have a pharmacological treatment, or you have a surgical treatment for this. So if somebody is dealing with arthritis, he is in early stages of arthritis. So just little bit that initially what happens is that there is reduction in the joint space, and once the arthritis increases into the advanced stage, then you have bone on bone rubbing. So initially, when it is just the start of the arthritis, then definitely few medications like painkillers, as well as some glucosamine supplements, as well as the most important thing is the lifestyle modification, cycling exercises, stopping the floor level activities. This is all going to help. But once the joint is in the advanced stage, and once there is bone on bone rubbing, then right now currently most of the joints you can do a replacement of the joint, or there are few other joint preserving procedures also which you can try. So it depends upon the stage mainly, that in which stage the patient is. In the early stages, definitely the treatment is only physical lifestyle modification and pharmacological therapy. But once the patient is in advanced stage, then treatment should not be delayed also.
Right. Thank you so much, Dr. Rohit. My next question to Dr. Ajeet. Sir, are there any recent advancements or innovative treatments in arthritis management that you would recommend, our viewers to explore?
See, there are recent advancement in osteoarthritis. Definitely, if we speaking about degenerative osteoarthritis, so there are, as Dr. Rohit said, there are joint preservation surgeries are available. Then there are some stem cells are available for the early osteoarthritis. Or if person is dealing with a traumatic, very small cartilage defect, he can go for a autologous chondrocyte implantation. So, see, what we are trying to convey here is either we are dealing with a degenerative osteoarthritis or an inflammatory arthritis. So, if the degenerative osteoarthritis, there are stages of treatment. In very early stage, as we all say, weight reduction, lifestyle modifications, these are the first stage where you can prevent arthritis, a degenerative arthritis. Definitely, you can delay the process of arthritis. Once it has set in, then the role of these pharmacological things comes. So again, in pharmacological, there are recent advancements. Like recent advancement, there are some molecules which are claimed to be a chondroprotective. With the consumption of those pharmacological agent like glucosamine, diacerin, they are in the market since ages. Now, the natural extract, rosehip extracts, and other nutraceuticals. There are plenty of nutraceuticals are available in the market. They have some role in preventing osteoarthritis and delaying the process. Then, if we speak about collagen, undenatured collagen, which is it's coming in the market. And from past 2 to 3 years or 4 years, all good pharma companies are selling this. So those also have some positive response of osteoarthritis. So these are the pharmacological recent advancements. What if we go in a surgical recent advancement, as we are surgeons, so we have to deal both the conservative, the drug one, and the surgery wise. So recent advancement in case of early osteoarthritis or a focal cartilage defect where the cartilage is gone. So it is generally accepted that once cartilage is gone, then there is no role of any kind of treatment available. It definitely goes into osteoarthritis. But nowadays, a recent trend is called as an autologous chondrocyte implantation, where we harvest a chondrocyte from the patient's knee itself, and then we transplant that same harvested cartilage into the knee. There are bone marrow extract and concentrates which are there in the market. Then there are chondrofillers, but they are still in a long way to go to confirm their potency. But ACI or autologous transplantations, they are in the market since good time, so they have their efficacy in joint preservation. While in case of inflammatory arthritis, there are few molecules which are there to prevent or halt the process of osteoarthritis. One is recently approved in the Indian market as tofacitinib. So it's orally available molecule which can prevent the early degeneration or early progression of the disease.
Right. Thank you so much, Dr. Ajeet. That was a very elaborate and descriptive answer. Thank you so much. Dr. Anuj, my next question to you. Sir, could you discuss the support system and resources that are available for individuals with arthritis so that they can lead fulfilling lives, and some of the coping strategies that they can use to effectively manage arthritis? If you could just shed some light on that.
So, just in continuation of what Dr. Ajeet had enunciated,
Right.
I think a lot of strategies are into place wherein a lot of people do not want a joint replacement to happen. In the early stage, as lifestyle modifications, namely the floor exercises, avoiding the floor, that is squatting and no cross-legged sitting, and a hot fermentation is going to help them a lot. Some passive exercises with a physiotherapist, through a physiotherapist, under the guidance of a physiotherapist, is going to definitely alleviate their pain. Next is if they do not want to go in for a surgery, the other molecules, the pharmacological agents, see, we need to understand that there's going to be a malalignment of the joint. For the knee joint, there's a malalignment, and therefore the pain occurs because your mechanical axis is shifted out, and there's a deformity in the knee joint. So finally, there are other procedures which are other than the mosaicoplasty that Dr. Ajit was had enunciated in greater detail. There are other options wherein we can give an ozone therapy, and we have pain portal blocks which are chondroprotective and condo regenerative. Also, we can do a high tibial osteotomy or a high fibula osteotomy also, which will realign the joint, and it's kind of a palliative treatment, and we can stretch the osteoarthritis for a number of years. Other than that, for older age people, the vision should be very adequate because that is the time they tend to not see things properly, get up in the night and not see things. The rooms should be well lighted, especially the way to the toilet should be, there should be no rugs in the vicinity of the old age patients, and also that they should not shy away from using a stick. Also, that loose wires like telephone wires keep on lying around. That is what entangles them and makes them fall and create the injury over there. So all these strategies can be employed for old age patients. Better vision, better lighted rooms, or the pathway to the bathroom because they have to get up a number of times during the night. And also no rugs wherein they can trip and fall. That is the time they might land up with a fracture, or it might create an event which is not very uh, good for them. So essentially, exercises may be assisted in front in the guidance, though they should be doing those exercises once they have landed from the physiotherapist or to themselves. But exercises are going to help them a lot. Secondly, all the lifestyle modifications like avoiding the floor and using a Western toilet and all will definitely help them delay the arthritis for a good number of years. Also, that medications definitely are of help, but then people, because of compliance reasons, do not take it for a longer period of time. So essentially, if we think of an ozone therapy, or now there's something known as N-stride, जैसे डॉक्टर साहब ने बताया था about this stem cell therapy, and also
Right.
PRP is also there, wherein some patients get a lot of relief with those injections. There's supplementation also in the form of hyaluronic acid. Some people also derive a lot of benefit out of it, but then it has to be very subjective. Each patient has to be seen in the perspective of how well he is going to tolerate the therapy, and no one therapy fits all. It is a combination of efforts which we need to do with the patient, including exercise. We need to understand the psychology of the patient as if to if she or he would be able to adhere to that kind of a therapy. Because if we tell them tomorrow that you have to do quadriceps exercises almost 20 times a day, maybe she's not psychologically inclined to do that much of an exercise. Also, that's a certain now podiatrics, that is your shoe wear, has a lot to do with how you can change the walk of the patient, which will offload your medial joint, which is the first to go in osteoarthritis. So all these podiatrics is going to also help the patient with the change of the shoe, the medial arch and all, or the lateral arch, just in case which one is getting loaded more. So all these strategies can be employed in the process of alleviating, if just in case the patient doesn't want to go for any bigger intervention.
Right. Thank you so much, Dr. Anuj. That was a very elaborate answer. Thank you. My next question to Dr. Rohit. So, what are some notable regional variations in arthritis prevalence within India, and how do they impact healthcare delivery overall?
So as we all know that means India is a vast country and we have a different subset of population. We have a urban population also, we have a rural population also. And as I initially told also that once you are doing a floor level activities, the amount of force acting on the joint, especially the knees, are quite high. So especially in the rural population, most of the works in the fields and everywhere else is done by doing all the floor level activities. So the prevalence of osteoarthritis, especially in the rural population, initially it was not that much, but nowadays because of the change in your food habits also and all those other factors, also environment and all those things, the amount of patients having osteoarthritis in the rural areas increased a lot. So, and once we go towards the urban sector, where most of the times you are not doing the floor level activities and all, and the most of the people are doing only office jobs, and just we are sitting on the chair and all. So this gives a lot of means a cushion to the knees, and also the arthritis prevalence, as we are seeing nowadays, is decreasing little bit, but still again, once we see the whole of the trend, because of the changing food habits as well as the environmental factors, the overall prevalence is increasing. But the patients with especially knee osteoarthritis in the rural population require those floor level activities more. So the amount of osteoarthritis in those patients are more as compared to the urban ones. Now, as the strategies also means very initially also described by all the speakers, that the floor level activity, especially even after a replacement, right now we don't have such a technology that for each and every patient we can say that after a knee replacement or a hip replacement you can do the floor level activity. So means in this case, all the joint reservation, the procedures which we are doing and the pharmacological therapies are coming into the mode, that you have to follow those things also, especially for the rural population. And also the cost factor is also there, that in the rural population the socioeconomic study is not that much, and the patients are basically a joint replacement is overall a costly surgery. So that also has an impact on the overall treatment which we give to the rural as well as the urban population. So we need to find more ways, but especially the initiative which you have taken, if we can inform the patients that what things you need to do and what things you should not do so that your joint will be more preserved, is a better way to just um, increase the life of your own joint, because after a replacement or anything also you cannot do all the activities which you can do with your native knee. So that's the thing.
Right, right. Thank you so much for that answer, Dr. Rohit. My next question to Dr. Ajeet again. So, what are the specific challenges or barriers that exist in certain regions when it comes to providing quality arthritis care in our country? If you could shed some light on that.
First of all, the major hurdle is the awareness, the casual attitude of the middle-aged aging females. Most of the time, you have heard it's okay, fine, they'll leave it. If you tell 100 of females in the middle age group that do quadriceps exercise, do weight reduction, why I'm being the gender biased over here? Because female are the one who are the most important factors in the family, and what they do is they don't take out a time for themselves. So that's why the prevalence of knee osteoarthritis is also very high. See, gender predisposition is already there. Apart from that, they neglect their health uh, very much. So in case of just
Yeah, sure.
uh,
Should
sorry,
we?
sorry.
Yeah. Okay, okay. Yeah. Please go.
So first barrier is the casual attitude of the patient. If they are focused about their knee, about their joint, they can prevent. So the first thing I would like to tell with this medium, because it's definitely it will be a Facebook live. So all the females, especially in the middle age group, where they are gonna be there will be a menopause, there will be a hormonal deprivation, so there will be having more of a osteoporosis. So most it's just a scientific terminology. If there is a more osteoporosis, the proximal tibia bend and the joint line shifted to the more medial side, and she will develop the osteoarthritis in very early stage. And I would like to say that Rohit has pointed out a very important topic here, that in urban population, aware females, the prevalence of osteoarthritis or the stage of osteoarthritis is delaying. But as we have a larger population, so overall prevalence is more. So awareness is one of the most important factor where we can just delay the process of degenerative osteoarthritis. Second, the cost of treatment. Though with all the therapies and everything, now the cost of treatment is also coming down. Uh, uh, and third is again the awareness about the surgical management. Like if you tell a grade 4 osteoarthritis patient that he or she requires a knee replacement therapy, there are a lot of myths that you will be bedbound or that this it will take long time, and there is some kind of a relations with everything. But with recent technology and now replacement in India is I guess it's like 30 to 40 years, and people are getting it done. It's like a 2 to 3 days of the hospital stay where any normal surgery can perform with the 2 or 3 days of the hospital stay. So there is a hitch of going for surgery also. So that kind of awareness, if you are in a grade 4 osteoarthritis, you are taking daily analgesic, you are in you are like you are your activity is limited to household only. Again, you are not going for a surgical replacement just because of some myth that you are not going to sit, you have to be bed bound. On those patients, we have to convey them that surgical modalities will provide them a better, longer, pain-free life without any analgesics, because the analgesic has some kind of a detrimental effect on your other system also.
Right. Right. Thank you so much, Dr. Ajit. Adding on to what Dr. Ajit was saying, Dr. Anuj, how can healthcare providers and communities as a whole work together to improve arthritis care? If you could just tell us a little bit about that.
So, as Dr. Ajit said, awareness is the prime thing. I mean, eye sees what the mind has known. Through these initiatives, if we can counsel a lot of patients about early detection and early treatment and seeking a medical advice early, so maybe we need not even may use pharmacological agents specifically or nutraceuticals that are available in the market. We can go in for lifestyle modifications as well as certain assisted tools that we have in our armamentarium. As I said, shoe raise might also help not load the joint that much, and also that floor exercises are going to be very, very detrimental for them. Having said that, people have a tendency to not do exercises once they start to having pain, though it's counterproductive for them because they stop walking, they'll stop going for their morning walks. All this is going to have, we need to counsel them and make them aware that the more that you will disuse your joint, not use your joint, it will create more of an atrophy over there of the muscles. Also, it will lead to some amount of osteopenia, that the bones over there start getting little osteopenic or osteoporotic, and that is the time your microfractures happen over there, and it is a vicious circle which the patient lands into, which creates the aggressive kind of an arthritis to follow. Having said that, not only awareness, we need to also on a mass scale kind of with through our local uh, clubs and local also orthopedic schools or orthopedic clubs also, we need to inculcate the sense of that everybody will not land into a knee replacement, would not require a knee replacement if we try and counsel them properly in early stages of arthritis, even till about the grade 3 of osteoarthritis. If we can counsel them properly and make them aware of what all things can be done prior, so we might delay arthritis for years together in them.
Right. Thank you so much, Dr. Anuj. I hope this discussion helps our viewers and they get some information and awareness about arthritis. Dr. Rohit, my next question to you, sir. Are there any successful case studies or initiatives that you've come across that you can share with us that have made a positive impact in specific districts or regions in terms of arthritis?
So as we are means right now discussing this, so this month only we have celebrated World Arthritis Day also. So it's an initiative which has been taken really nicely by our medical fraternity, and we try to means educate people on that day most of the time, that what are the different types of arthritis, how you can manage that, and as very nicely described by Dr. Anuj also, the collaboration also is very much required. It's not only the doctors, you can involve the physiotherapists, the nutritionists, as well as we have our local Anganwadi workers and all. We can involve each and everybody in in a circle, which will help us to provide the information to the grassroots level. So right now, means the Orthopedic Society also, and also the Indian medical education system is giving a lot of emphasis on the arthritis, because it is one of those things that you can prevent. So if you do all the proper things before the age when it is too late, so it is going to help you a lot. So the most important thing is definitely the awareness and the education of the patient. So at the district level, we can use our CHCs, PHCs, also means the local NGOs as the VOH group and all, to just give this information to all the patients, that how to prevent, and if you have osteoarthritis or inflammatory arthritis, how to live life successfully with that.
Right. Sir, following up, you just mentioned a few organizations like Anganwadi, Indian Medical Association, etc. Are there any more such organizations, government or non-government, that are leading the way in raising awareness and providing support for arthritis patients?
Sorry for that, because I don't know exactly the name of specific societies for that. But as I have told you that I have means I have seen multiple, especially the
Right.
nutrition society. From the nutrition society, we have started a bone and joint health things, so that we can give the awareness to the patients.
Right.
So I don't know a lot of organizations who are doing that, but definitely on the larger scale, the major organizations are looking after these things.
Right. Thank you so much. Dr. Ajit, my next question to you. How does arthritis affect vulnerable populations, such as the elderly or those with limited access to healthcare resources?
See, osteoarthritis or degenerative arthritis or rheumatoid arthritis in an aging population is I can say that is an economical burden also. If we reduces the osteoarthritis or early osteoarthritis, definitely the lifespan increases, the quality of life increases. So that is one of the most important factor. And those patients, if they are if in aging population, patient has developed an osteoarthritis, they will have definitely a limited mobility. And the cycle goes on. The limited mobility leads to more of a osteoporosis, more of a because in osteoarthritis, not only the nutrition part is important, the cyclic loading of the bone is also very important. In osteoarthritis, what happens? Patient will have a painful joints, so their mobility, the daily mobility will reduced. So why it causes an economical burden? Definitely, if they are living with uh, uh, with a working class population, they have to look after those aging patient person also, and sometimes it gets very difficult. And once the patient is limited to bed, whatever nutrition you are providing, their cyclic loading to the bone is very less. So it develops a severe osteoporosis. So that kind of patients develop a fragility fall or fatigue fall or fracture neck of femur. So that's why the prevention or delaying the process is very important, especially in the osteoarthritis.
Right. Thank you so much, Dr. Ajit. Uh,
Uh,
so, are there any specialized programs or initiatives that are in place to help, such populations that are more susceptible to developing arthritis?
So, as Dr. Rohit mentioned, there is a nutrition society, but not as a generalized or programs or given in a road book, but majority of orthopedic clubs or of individual orthopedic surgeons or a pharma companies, we do a camping of osteoporosis. So osteoporosis preventions program is also there, and particularly osteoarthritis is not included into that. Ma'am, I'm extremely sorry. I have to leave because I'm getting a call from OT.
Okay, okay, so no
So
problem.
it's
Thank you so much for
so
joining us.
there is
We'll
no there is no particular program as such, especially for the osteoarthritis. But yes, for osteoporosis, all the local clubs, all in fact, Indian Orthopedic Associations is also very committed to it. In coming themes also, they are coming for the osteoarthritis programs. Uh,
right. Thank you so much,
so
Dr. Ajeet, for your time. Yeah.
okay, fine, fine, fine. Welcome and good day, everyone. It was a very nice discussion, but I have to leave early.
Thank you so much for taking out the
Bye,
time.
Dr.
Thank
Ajit.
you.
Bye, Dr. Preeti.
Dr. Anuj, my next question to you, sir. What preventive measures can individuals take to reduce their risk of developing arthritis? Is it preventable at all, arthritis?
So, ma'am, this is a very pertinent question. You and very good question you've asked. Uh, to us, orthopedic surgeon, even Dr. Ajit and Dr. my co-panelists will agree that they land to a orthopedician once it is grade 3 and grade 4. Prior to it, they'll keep on popping up some painkiller, maybe a Voveron or a Combiflam, which is easily available, and they try to be very careless about their arthritis. So essentially, we need to understand that see, arthritic pain or an osteoarthritic pain is a waxing waning pain. You may have a period of heightened pain and a heightened disability at that point in time, but it definitely will go into a remission. And then again, after a few time, there'll be a recurrence of that. So if we can make them aware of this, that if at a very early stage if they come and seek some medical advice from a doctor, it definitely is going to change the perspective of how they are dealing with arthritis at home. So, not being callous about it, not being not just thinking that it is part of an aging process and everybody is bound to get it. Everybody is getting it. That is correct, but everybody is not even seeking the right kind of an advice from anybody, or maybe the local doctor, the local physiotherapist, and the local doctor is always there to help him out. So, not essentially a painkiller is the panacea for everything. So, if we can essentially make them understand at a broader perspective that an early arthritis will delay your aging of the joint by many years, even decades. So this will go as a long way as a good message to all your people who are here, audience, you who are here, that an early intervention by a doctor, not in terms of any injections or any painkillers or any pharmacological agents, just certain tools that we have in our armamentarium is going to help him relieve a lot of pain and put him on some rigorous exercise regime, which is non-weight bearing.
Right. Right. Thank you so much, Dr. Anuj. Uh, Moving on to Dr. Rohit now. Sir, are there any technological advancements or digital tools that are proving beneficial in the management and treatment of arthritis?
So, as we all know that we are moving towards the digital world more. Regarding different stages of treatment, as we can do right now, we are doing the Facebook Live and all. So you can give the digital information to the patients that how to manage, what are the early signs and symptoms, and what are the treatment options available. But as we go into more details and the surgical part comes, nowadays initially for the knee replacements and other joint replacement, we had the navigation. Now we are moving towards the robotics, and also we are going into the virtual reality also. So means with the advancement of science, and also because of all these AI and online platforms and all, the things are moving at a very fast pace. You can teach the surgeons also that how to perform a surgery on a faster scale, and also you can give the information to the patients also that what exactly is done in the operation, so that he knows each and every step that what he is going to go through. Because once you have the information that what is going to happen, all the level of anxiety and everything goes down for the patient. So now, because of the digital thing, we can get to a larger audience. Right now, if your viewers are watching, we can give it to thousands of people right now. What is osteoarthritis? And what, that is what we are doing exactly right now. But initially, when the social media and all these things were not there, so at that time it was difficult to give information to a larger population.
Right. I think social media has become, such an important tool today in order to bring information. Anything that we face, we tend to, just Google things in order to find out. But
Yeah,
yeah, thank you
everything
so much.
Google is not always right. So that should also
Yes,
give information that
yes,
all the information which is available online is not always correct. So
yes. We should definitely consult our doctors before, taking any steps in order to be safe.
yeah.
Right. So, following up on that, Dr. Anuj, how can technology be leveraged in order to improve access to information and support for individuals with arthritis? I think Dr.
So
Rohit
one,
has answered some of it. You could just add on to
so there's some things which are recently being added into our replacement field, wherein till now we had um, computer assisted devices, then we had robotics. And now, for the first time in India, through halogenics, through virtual reality and wearing a headgear, there are instrumentations which are going to be marketed all around the world. This is a Make in India project, wherein replacement is going to be done by the tools of um, more robotically, more accurate, and there's planning before it. So social media in itself is going to be a major tool to uh, put awareness in the minds of the people, and we are making big strides, not only in terms of the pharmaceutical industry, which is helping us getting newer molecules to treat the early stages of arthritis. Even he's the first Indian, Dr. Shah, who is bringing this halogenics and is going to be marketed all over the world through uh, the Make in India initiative. But uh, the awareness part has to be looked into through only social media, because one-to-one interaction through a society or through a club is going to be very limited. Maybe we can get 50 odd people to get to sit and listen to us. But social media is going to definitely help, and I am sure that companies like Pfizer and people who are into this, because our learning curve is occurring now, since our aging population is the average lifespan has started to go higher from 70 to 80 to 90 now. But the Western world had learned this much prior to us, and a multinational company like Pfizer and other companies can learn from their learning curve and bring that to India. And today we have this tool of social media, which is going to help us in a major way to spread to the masses that a lot can be done before a knee replacement is eventually required.
right. Thank you so much, Dr. Anuj. My next question again to Dr. Rohit. Sir, how can individuals with arthritis become advocates for themselves and their communities? From what they learn through their journey of fighting arthritis and living with it, how can they become, advocates for themselves?
So as we are in our OPDs and all, sometimes we see few patients who say from their end itself that I know much about my disease and my, all the things what is happening with my body. So this happens definitely if you are definitely suffering with a disease, then you know a lot about it. So the person who are suffering with arthritis and they have changed their lifestyles, also if they've undergone any surgical procedure or anything, they should also come forward, because as initially also we discussed that there is a lot of stigma in the society that you cannot do this after a replacement, you cannot do that. And also initially also that I will continue doing my all the floor level activities, the things will get better. So the awareness part is one thing, but if the person is suffering from arthritis and if he has done some exercises and all in his own society and the people with whom he meets, he should give that information to them also, that I have stopped doing these activities and all in the early stages and it has helped me. Especially you have a lot of cycling societies also. I have few patients who are suffering from arthritis. Now they've joined a cycling society. They go every weekend for a cycling, and now they're feeling really, really good. So these sort of things also, it is recreational also, and it is helping your disease process also. And as we are operating on the replacement patients also, whenever I operate on any patient, I make a video also, and also the patient outcome, what he said after the operation and all. The patients who have undergone the surgery themselves, they should also come forward and tell me, all the other patients, that after the surgery it's not like that you cannot walk, or there will be always pain, or you will be always bedridden. The people are walking the same day after a surgical procedure nowadays. So these sort of stigmas which were there before, that Mr. Atal Bihari Vajpayee's knee failed, so knee replacement is not a good operation. So this was not right actually. So these information, especially by the patient, if it is given, it gives more credibility. Because as
Right.
doctors, we are always saying, but once it is coming from the own society people, then it gives a lot of courage to other people.
Right. So true. All right. Doctors, any parting messages or words of wisdom that you'd like to give our viewers? We'll start with Dr. Anuj. So, any closing remarks and message that you'd like to give out to our viewers about arthritis?
See, a knee replacement often with a very bad knee is definitely the only panacea that we have. But then we need to understand that there's something known as the sensate knee, the normal knee that we have, which is the sensate knee, which is sending impulses to the brain for our balance, is always the best knee. Try to preserve it. Try to preserve it if we delve into this kind of a scenario, if we know that age is going to catch up with us, definitely we're going to get osteoarthritis. If we can get into strategies which will prevent and delay arthritis, is always good, because an insensate knee and an artificial knee is not going to send you impulses to the brain and your positioning sense, your balance, and that is the time a lot of bilateral knee replacements tend to fall more often than the regular patients, and those are the people who lack very prosthetic foots. So it is definitely for the end age arthritis, it is the best thing to go in for a knee replacement. But prior to it, if you really consult your doctor, who's inclined to make you pain free and who's inclined to make you live with the original leaf for a longer period of time, this eventually should be the mainstay of treatment.
Right. Dr. Rohit, same question to you. Any words of wisdom that you'd like to give our viewers?
So the first thing is that we had a really good conference, and in this we discussed all the things. So these sort of online initiatives should be done more, I guess. And as very nicely described, definitely knee replacement is not for early arthritis and all. But once it's a grade 4, then you don't have any other option. So definitely that is a procedure which you should keep in your mind. But definitely the awareness part of it, the lifestyle modification, and especially the initial pharmacological therapies are also very, very effective in these cases. So once you are in the early stage of arthritis, you should start doing all the things required so that you can prolong the native knee, because definitely the knee given by the god is cannot be replaced. But definitely if it's in the advanced stage and all, when nothing else is working, at that time definitely you have to think about the surgical part also, which is available right now.
Right. Thank you so much, Dr. Rohit, Dr. Anuj, for joining us today. It was a wonderful discussion, and Dr. Ajeet also, he had to leave early, but I think it was a wonderful discussion, and I'm sure our viewers have learned a lot about arthritis and how they can, make small changes in their lifestyles to manage and prevent even arthritis better. So, thank you so much for joining us today, and yeah.
Thank you, Katyayni. Thank you, Dr. Pandey.
Thank you, Dr. Anuj.